With infectious disease without vaccine, there is no safety in numbers. Quote by Mr. Berkeley, CEO, Global Vaccine Alliance. This is Dr. Debasish. Welcome back to my channel. It all started few months back when researchers started developing first coronavirus vaccine. Now we have more than 170 coronavirus vaccine candidates all over the world. Few of them are most promising and expected to hit market in few months. So let's see the current status of all coronavirus vaccine candidates all over the world, including India. When these vaccines are expected to be ready for market launch, who will be given this vaccine, how this vaccine will be given, how effective this vaccine will be, what will be the side effect of these vaccines, what will be the price of this vaccine. So let's begin. As per the document published by WHO on 9 September 2020, 35 coronavirus vaccines are in clinical trials, where these vaccines are being tested on human beings. Out of 35 vaccine candidates, 9 vaccine candidates, 4 from China, 2 from US, 1 each from UK, Russia and Japan, are in phase 3 clinical trial, where these vaccines are being tested over thousands of people to see effectiveness and safety of these vaccines. All these vaccines are expected to be ready for market launch by the end of this year or early in next year. The first coronavirus vaccine, Sputnik V, produced by Gamaleya Institute, Russia, got registered already on 6 August 2020 and is being tested over 40,000 volunteers from 20 countries all over the world. In India, the vaccine developed by Oxford University in collaboration with AstraZeneca and Serum Institute of India, this vaccine has started phase 2 and phase 3 clinical trials simultaneously, and it's being tested over 1600 volunteers at multiple hospitals across the country. This vaccine is expected to be ready for market launch by end of this year. The India's first indigenous vaccine, produced by Bharat Biotech in collaboration with ICMR, completed its phase 1 clinical trial and started phase 2 clinical trial on July 2020. It is being studied over 1123 volunteers at 12 hospitals across the country. India's another indigenous vaccine, Zycop-D, developed by Zydus Cadila Pharmaceutical Company, has completed phase 1 clinical trial and started phase 2 clinical trial on August 6, 2020. This vaccine is being tested over 1100 people at Zydus Institute, Ahmedabad. These indigenous vaccines are expected to be ready for market launch by early in next year. Who will be given this vaccine? As there will be a huge mismatch between the need and supply of coronavirus vaccine initially, the global population will be divided into groups according to the risk of coronavirus infection. The topmost priority will be given to the group who has highest risk of coronavirus infection, such as healthcare worker, elderly, and people having pre-existing health condition. Once these groups are covered, further more and more groups will be vaccinated in phased manner. How this vaccine will be given? A certain amount of vaccine, expected to be 0.5 ml, will be injected into the muscle of your non-dominant upper arm. A similar dose will be repeated after a certain interval, expected to be 3 to 4 weeks. Multiple booster doses may be required in certain intervals for persistent immunity against coronavirus. How effective it will be? According to vaccine researchers, the effectiveness of the coronavirus vaccine will be 60 to 70%. That means 30 to 40% people will have their risk for getting coronavirus infection, though they will be already vaccinated to coronavirus. What are the side effects of coronavirus? So far, coronavirus vaccines are safe and have mild, short-lasting and non-life-threatening side effects like headache, feverish sensation, fever and the pain in arm. What would be the price of coronavirus vaccine? As per the agreement signed among Oxford University, AstraZeneca and the Serum Institute of India, Serum Institute of India will supply coronavirus vaccine to lower and middle income countries including India at $3 per dose. As per news source, US pharmaceutical company Pfizer will keep the market price of coronavirus vaccine under $20. So expected price of coronavirus vaccine may be roughly $3 to $20. Few facts in this video are presumptive based on the evidence we have so far, may change in future. So thank you for watching this video. Please subscribe my channel.